to the DON training program. My name is Bilquis. I am an RN and Certified Director of Nursing and Administration in Long-Term Care. I am certified through NADANA, and I am also what they consider a fellow Academy member. Okay, and to top it off, I'm the Vice President for the Pennsylvania chapter. All right, so I want to thank you again for tuning in, and I just want to give you a little information about myself. I have been in long-term care for 17 years, and within those 17 years, I pretty much held any position in the skilled nursing side. Okay, so I started out my career as an LPN, and then I, developed myself into each role. Okay, I went back to my RN, and then I was a supervisor, unit manager, and then DON. Okay, so this program comes with years of experience on different levels. Okay, so I know what it's like to be approached by the surveyor as an LPN. I know what it's like to be approached by the surveyor as a unit manager. I know what it's like to be approached by the surveyor as a supervisor. And I know what it's like to be approached by the surveyor as a DON. Okay, so this is a lot of expertise that you're going to be getting when you're signing up for the DON training program. Okay, because as a DON, as a nurse leader, you have to have the ability to lead. Okay, you have to be able to identify what each person on your team is supposed to be doing. Okay, what are they supposed to be producing? All right, and when we don't know that, then that's how we have those negative outcomes that we don't want. Okay, so in this program, you're going to learn all about that. All right, so when you sign up for the program consists of 7 courses. All right, and they're geared to give you a blueprint of how to navigate and become successful as a DON. Okay, we have our leadership course, which is very important. Okay, we have a lot of new DONs coming into these positions, and we don't even know, or you don't even know, if you have the leadership capability. Okay, do you know what type of leader you are? Okay, because that's how you're going to determine how you're going to grow your team. All right, these are some of the things that you need to start thinking about when you are offered and accepted a DON position. Okay, we're going to teach you about this survey. Okay, like I said, I've been in long-term care for 17 years, and in each of those settings, I had to deal with a surveyor on different levels. Your team needs to know how to deal with surveyors on that same level. All right, you have to be able to know how to manage your survey. Your team needs to know how to manage your survey, and that's what you're going to get in the course. All right, we have our rounding and incidents and accidents. Why did I produce that course? Because when surveyors come, they round. Okay, and I don't just round to just round. Okay, I round with a purpose, and that's what you're going to learn in this course. All right, that's how you're going to know how to produce positive outcomes. All right, what are you seeing when you're rounding? All right. We're going to talk about morning clinical. We have a morning clinical course, and you're going to know the connection between the morning clinical course and your survey. How are they interconnected? Okay, if you don't have a good morning clinical, then you're not going to have a good survey, and I'm just going to say that, and that's the honest truth. Okay, because your survey is dependent on that morning clinical and everything that goes into it. All right, so you're going to see how we connect the morning clinical to the survey prep course. You're going to see how we connect rounding to the survey prep course. All right, we have a grievance and customer service course. All right, that course is created because we have so many complaint visits. All right, so when we don't manage our grievances and we're not following up effectively in a timely manner and those concerns aren't addressed, then guess what? You're going to have a complaint visit. Okay, the other thing that you need to start thinking about is, who is your customer? Okay, your customer just isn't your residents and their families. Your customers are your employees. Okay, so how and what are you doing to retain your employees? Are your employees happy? Okay, a big factor, because guess what? If you don't have staff, then you can't produce outcomes. Okay, well, the outcomes that you're going to produce are going to be negative outcomes. So you're going to learn how to be good to your staff if you don't know how. Okay, we have our infection prevention and control class, and that's not the deep infection prevention and control that you would get from the NADANA course. This is teaching you how to manage during a survey. Okay, these are going to teach you how to map, how to track and trend, how to be aware of where your infections are, because that's going to help you with bed management. Why? Because we need to make money. We need to have good admissions. And so you need to be able to identify where these patients are at all times, so you know who you have to cohort, when you have to cohort, or if you have to change rooms. Okay, but more importantly, you're going to have VIPs. These patients are going to be your VIPs during that survey. All right, and I don't just do survey during survey window. Okay, we here at the DON training program is survey ready every day, period. Okay, there's no, oh, my survey window is opening and then now we're going to focus on the things that we need to be doing that we should have been doing all year round. Okay, that's what the DON planner is for. You track every day for 12 months. You're doing the same thing, okay? Consistency produces positive outcomes, okay? You have to be disciplined to do the same thing every day. Okay, that's how you're going to become great at what you do. Okay, we have our leadership, I told you about the leadership course, but these are just the courses that we have to build up the entire program. Okay, so like I said, the Round-In program, the DON training program consists of 7 courses, and it is definitely a blueprint on how to navigate through your facility. All right, we have another course, our admissions and discharge course, very helpful course. Why? Because admissions, that hospital transfer was a highly cited area. Okay, so we have a course just geared on that. Okay, your admissions. Okay, you want to know how to handle them from the time they come to the time they go. And why? Because they're going to look at those new admission charts during your survey. And guess what? They're going to pull some closed charts. So whatever is open, we need to make sure it's closed. All right, and all the gaps in between there needs to be completed. All right, so you're going to learn how to do that, and you're going to utilize, if you don't have a tool, we have an admission check tool for you that you utilize for that. Okay, so that is our DON training program. All right, so if you are a new DON, definitely this course is for you. This program is for you. If you are a DON and you still just don't have a clear picture, all right, if you're that busy DON that has 100 tasks open up a day and nothing to produce at the end of the day, then you need this course. Okay, because we're going to teach you from stop being busy and being productive. Okay, because a lot of times we have all the things that we have to do. We haven't delegated a damn thing out. We're doing everything. Nothing has been delegated to our team, and if it has, we haven't gotten it back. All right, so you really have to start knowing how to prioritize, how to stay organized, but more importantly, you have to get in the habit of doing the same thing every day. Okay, you need to know how to turn your phone off. You need to know how to tell your receptionist hold all calls during important meeting times because you have outcomes to produce. All right, the only way that you're going to get the salary that you want, the only way that you're going to be able to get the admissions that you want is by being disciplined, being consistent, and following through on everything that you're supposed to do as a nurse leader. Okay, so there's a lot that's going on out there where we're challenged for admissions. And you're probably getting especially if you're a 1 or 2 star facility, even a 3-star, you're probably getting the bottom of the barrel admissions, right? The admissions that have all the behavior problems, nobody wants these type of admissions, but you have to take them, right? Because you can't be picky, all right? So you're going to learn how to start being picky, all right? Because you're going to be able to now produce the outcomes that's going to improve those survey outcomes in your facility. All right, this is everything that you're going to gain as a student here at the DON training program. All right, so if you have questions, concerns, email me, all right, or drop a comment, but definitely sign up for the program. All right, and like I said, this program isn't for everybody, but it's definitely for those who are in need of assistance. All right, and I promise you, you will not regret this program. All right, we have done great with our students. And like I said, the program comes with the DON planner, it comes with the DON strong notebook, and it comes with the DON follow-through workbook. Okay, all of these are going to take you and your facility to the next level. However, if you do not do the work, you're not going to get the outcomes. If you're not going to be disciplined and take in charge of your career, then you're not going to get the outcomes. All right, never put your career in the hands of someone else. Whatever it is that you need to do to improve yourself as a nurse leader, improve the quality of care and the quality of life as a nurse leader, then you need to do that.